This episode of the Dr. Hilary Show is brought to you by Hidden Hearing, one of the UK's largest hearing care specialists. According to the World Health Organization, nearly 50% of people aged 12 to 35 risk permanent hearing loss. That's over 1 billion people worldwide. Simple changes, such as using headphones safely and following the 60-60 rule, that's listening at no more than 60% of your device's volume and taking a break after 60 minutes, can help protect your hearing. Hearing loss is part of the natural aging process due to the tiny hair cells in your inner ear becoming damaged through gradual wear and tear. Our lifestyle choices are causing this damage to happen earlier as well. These days, wearing a hearing aid is as normal as wearing a pair of glasses, and it's just as easy to get help. Hidden Hearing is on a mission to help more people hear better by providing free tests and expert advice. You can find out more about how to protect your hearing and take the free 5-minute online hearing test at hiddenhearing.co.uk. Before my first guest, what answers do you need about your health, those niggles and problems that just won't go away? I receive so many messages asking about your health, whether it's advice on sleep, diet, mental well-being, or just everyday medical concerns. And now it's your chance to get some help with Ask Dr. Hilary, where each week I'll answer your health and wellness questions right here on the show. If there's something on your mind, just let me know. Just send your questions to ask@drhilaryjones.com. Don't wait, get involved, and let's talk about what really matters to you. Now, according to the World Health Organization, over 1.5 billion people experience some degree of hearing loss globally. That's expected to rise to 2.5 billion by 2050. If you're worried about your hearing, you won't want to miss my next guest. Laura Ewen has been working as an audiologist for nearly 14 years. Laura, welcome to the programme.
Thank you for having me.
Hearing loss is actually much more common, I think, than people realise. We're talking about 50% of people over 55 and 80% of people over 70. And on top of that, we know that a lot of young people are at risk of damaging their hearing right now. People aged 12 to 35, 50% are at risk of hearing loss because how they're living their lives. This must alarm you as an audiologist whose whole raison d'etre is to help people with their hearing loss.
Absolutely. The survey recently has shown that nearly half of children aged 12 to 35 are at risk of damaging their hearing just through recreational activities, listening to headphones, gaming headsets, listening to music too loud. The damage that we do now will prevent us hearing in the future.
I mean, that's really important. This is something that we all need to be aware of right now. But I think people are confused about the different causes of hearing loss. So some babies are born with hearing loss. Some babies and children will acquire hearing loss through infections or head injuries. Some will be exposed to too much noise that we've been talking about. But there are so many different reasons. And you must see thousands of people for all sorts of reasons that have become hard of hearing.
Absolutely. The reasons for hearing loss, there are many across the board, but two of the most common would be age-related hearing loss, just a natural deterioration of those tiny hair cells in the inner ear, and noise-induced hearing loss. So those hair cells are damaged by exposure to loud noises.
Now, we all recognise people who are suffering from diminishing youth. They're getting on a bit, and they've got the TV on too loud. They've got the radio at full volume. They're saying, "Could you repeat what you've just said?" They get confused about telephone conversations that they can't hear properly, and they miss out on so much, don't they? Socially, they stop going out. They stop engaging at parties and in conversations in the pub or in the club. They neglect their hearing for too long, don't they, when something could be done about it?
It comes on so slowly that people don't wake up one day and suddenly can't hear in most cases. So it's something that they just get used to over time. They notice people mumbling. They can't hear as well, whether in group situations or if there's any background noise. And it creeps up on people over time, so they tend to put it off. But the sooner we do something about it, the better the results.
And it's very frustrating for everyone around those people, isn't it? Because they're having to repeat themselves so often. Sometimes they stop talking to that person.
Absolutely. The amount of families that come into our clinics, and it's the husband, it's the wife, it's the son, it's the daughter, that are actually more affected by the hearing loss every day, because they've watched their loved one fade away. They've watched them take themselves out of family events and parties, and they stop having as many conversations. And to see the family come back once they've been fitted with a hearing aid and see the difference in that person, it makes it really special.
And I've seen that difference so many times. What makes people so stubborn about waiting so long to see somebody?
I think there's a couple of things. I think people don't want to admit that they may be getting a bit older and starting to notice some problem with their hearing. And also people are a bit put off by what wearing a hearing aid or what it might result in. Just recently, actually, we held a training event for some of our staff. And one of the sound technicians from the venue approached me at the end, and he was a young guy, just in his early 20s, and he said, "This has been really interesting for me." I said, "Oh, that's good." And he said, "No, I have signs of a hearing loss because of the industry he works in. He's exposed to a lot of noise, and tinnitus is one of them, so ringing and buzzing in his ear." And he said, "I've put it off because I'm so worried I don't want to wear a big horrible hearing aid and I don't know if it will fit with my lifestyle." He said, "But seeing the advancements in the technology and the products that you have available," he said, "I'm going to go and book a hearing test right now."
Well, we'll talk about the technology in a moment, but it's no longer the beige banana that people wear behind it. It's no longer the scope that grandmothers used to wear back in the day. It is much easier now and less stigmatised, and that's very important. So talking about the other signs, we've talked about the TV and the radio being on very loud, mumbling. What other signs might there be for somebody to notice that the hearing isn't what it should be?
So hearing in groups and background noise is one of the most typical problems. So people often come in and say, "I can hear just fine in an environment like this with no background noise. But when I go to the pub or when I go out for a meal, I really struggle to pick up the conversation." So they can often hear the volume, but they don't have the clarity. So that's one of them. Also a ringing or a buzzing can be tinnitus. People often notice. And again, that can come on quite gradually. So it's not something that people become aware of straight away. But when they step back and think about it, they realise they're having quite a few symptoms all adding up.
Okay. I mean, I certainly have been guilty of being in a crowded room and guessing what someone's just said, saying yes or no, hoping that I'm saying the right thing. I think we've all been there.
Absolutely.
To some extent.
And there will be situations that even with perfectly normal hearing, you will struggle to hear if there's a lot of background noise. But when you start to notice it's impacting, more and more of your everyday life, and the TV's turned up and the radio, as you say, that's when it's time to do something about it.
Well, there is a lot of noise pollution, and of course younger people are playing personal devices at a very loud volume. And I think it's true to say, isn't it, that if you're sitting on the train opposite somebody and you can hear the music they're playing, they're damaging their ears.
Yes, definitely. Even on the way here today on the tube, I could hear several people's music all coming through their headphones, and I really wanted to stand up and tell everybody, turn it down. Hidden hearing, we're pushing the 60-60 rule. So we want everyone to follow that. And that is listening to headphones or a gaming headset at 60% of the volume for no more than 60 minutes at a time. Take a break, have a little rest, give your ears a rest. And that really will make a difference to protect your hearing.
So your hearing does recover after that 60 minutes. If you give your ears a chance.
Yeah, it can. It can just help take off some of the pressure from some of the hair cells and just give them a break so that it's not prolonged exposure to loud noises.
Well, if we talk about music, what about going to concerts where, that they insist on playing the music extremely loud? And if you're standing next to a speaker, is that potentially damaging?
It can be. Anything over 85 decibels, which actually a common food blender can be 85 decibels. But obviously at a concert, it's a prolonged time. Now, if you go to a concert every now and again, you're not going to do permanent damage to your hearing. But what we would say is if you're at them regularly, wear some ear protection. Just take off some of that edge of the sound. And if you're at a festival or a concert that's going on for a long time, step back from the speaker, again, have a little rest and give your ears a break from that loud noise.
And I guess wearing ear protectors in certain trades is important as well. I mean, working with a chainsaw, for example, you do see people much better these days, doing their health and safety and wearing the headphones.
Yes, absolutely. There's so much noise exposure in a lot of employment. So we would definitely urge anybody, again, those sounds over 85 decibels, to get some ear protection on, get some headphones on. They're nice and comfortable now. There's lots of modern versions, so they can be easy to wear.
Now, I know that we've talked about the stigma, so people might walk past one of your outlets and say, I don't think I can summon the courage to go and see an audiologist just yet. If that is the case, and that's wrong, we know, there is an online test that people can do at Hidden Hearing that takes, 5 minutes to do?
5 minutes online test on the website. You can do it in the comfort of your own home, and you don't have to be worried about going in and getting the test results. And it can indicate if your hearing is normal or if there is the start of a problem. If it does, we would urge you to go in and get that hearing test. All of the clinics offer free hearing assessments. You can actually get hearing assessments all across the high street. You can also go through your GP and get them through the NHS. It may take a bit longer, so we would urge people to do something as soon as possible.
What's the difference between high frequency and low frequency hearing loss?
So typical noise-induced hearing loss and typical aging-related hearing loss tends to be higher frequency, just because of the shape of your ear and the science behind it. Low-frequency hearing loss tends to come from some of the other conditions, the acquired and congenital conditions. The low-frequency hearing will be when people notice a change in the volume of sounds. The high-frequency hearing loss is when people start to notice they can hear the volume, but they can't hear that clarity.
Okay, really interesting. Now, if they come and see you, they're going to get expert advice. Where do you start? You identify somebody who's got hearing loss, and you've talked a little bit about how it's impacting on their life. What's the next step? What advice do you give them?
If we identify hearing loss, we would tell them their next steps and give them their options. So we would first of all give full results so that they know exactly where their hearing falls on the chart. And then we would, if hearing instruments are the right route to go down, they would try them in. We would talk through all the different options of what's available, but they would actually try them there and then to see how they respond to the sound.
Yeah. Now, talking of the technology, there's a whole range, isn't there? Now, some are relatively inexpensive, some are more expensive, but I guess you get what you pay for. Tell me about the state-of-the-art technology that is there.
Yeah, absolutely. There's a full range to suit different lifestyles and different budgets as well. The state-of-the-art hearing aids really are a world apart from what people probably view hearing aids are, as they have sensors, they use AI, artificial intelligence, to really get the most of the environment that someone's in to be able to help their hearing as best as possible.
Okay, and these days they're almost invisible, aren't they? You'd be hard pushed to recognise some of the smallest hearing aids where it's just a tiny filament, which is the antenna.
Yeah. There's lots of different styles, and that's something that the audiologist would talk through. If someone came in to see us and they did need them, they would show them the different styles and find out what would be most suitable for them.
And I'm guessing that because young people and musicians are used to wearing something in their ear, an earpiece, that for many young people that stigma has gone. It's okay to wear something. They see TV presenters with an earpiece and they think, oh, it's cool. And it's becoming much more like wearing glasses, and it's normalised.
Hopefully, and that's our mission. We want to help more people to hear better. So anything we can do to raise awareness and break that stigma is great. And you rarely go past someone now when you're in the street without earbuds or headphones in. Hearing aids can be made to measure in different sizes of fittings into your ear, so they're actually more comfortable than a lot of the standard headphones that people wear.
And we know that the NHS struggles to provide people with the care and attention they need as quickly as possible. So, places like Hidden Hearing are a very good place to start, to come in for a free test, some advice, and to go on from there. You give people choice. Absolutely.
The NHS do the best they can, but they obviously have some limited resources, and it can vary depending where you are as well. So that's the good thing about Hidden Hearing is it's a national company, so it's available to everyone for that free hearing test. And we will give you the next steps. If someone chooses that they want to go down the NHS route after finding out they've got hearing loss, then we'll be able to help with that as well.
Excellent. So, Laura, what's your overriding message to people young and old to look after their hearing, to keep it as good as it can possibly be throughout their life?
It's never too late to start protecting our hearing. The damage that we do now will impact us in the future. So follow that 60-60 rule, think about your ears, and if you notice any sign of a hearing loss, get something done about it. Go and get it seen. Don't put it off.
Wise words, Laura. Thank you.
Thank you.